There's a lot of new information along the whole spectrum of breast cancer care. I can start with identifying the risk factors for breast cancer. The one that people are most concerned about is the strongest risk factor, which is familial tendency or inherited predisposition. We've known for some time now that the population frequency of the BRCA1 and 2 mutation is about 1 in 300, although in certain populations like people of Ashkenazi Jewish background, for example, it may be high as 1 in 40. And so when we see patients with a strong family history or who develop breast cancer at a very young age, we are now testing for that gene. Recently, we've learned that there's many other genes that are involved in DNA repair, like BRCA1 and 2, that we called an expanded panel of genes, and we are now starting to test for those too, because we may miss some of these when we see strong family histories, but they test negative for BRCA1 and 2. So there was a lot of new information in this program about some of these other genes, like PALB2, for example, and fortunately, the ability to detect these has really greatly improved with some of the new DNA sequencing technology, and there are many companies now that are offering expanded panel testing. So you don't want to test too expanded though in someone that doesn't need it, because sometimes you get results that are difficult to interpret. These are so-called variants of unknown significance. So there's a true art and science to identifying which panel or which test to do in the right person. So what's important really is that for anybody who's diagnosed with breast cancer at a young age or with a strong family history, they should really be seen by a genetic counselor that can review this with them, help decide which test is best, and then most importantly, when the test results come back, counsel them as to what to do.